Welcome to Behind the Mic, Conversations of Hope. I am excited to share with you my guest today, Dr. Mark McNear. Mark, thank you so much for joining us today.
Thanks, Mike.
I ran across you actually through your book, which I'm going to share with you right now. You can see that. It is Finding My Words, a Ruthless Commitment to Healing Gently After Trauma. You have a foreword in this by many people, but none other than Josh McDowell, which is a great endorsement there. This is a new book, 2022. I kind of want to talk about this, but you share a lot about your story in this book. And so that's why I asked you to come on, is I would really like you to share your story. Give us a little background of who you are, what your profession is, and then tell us about your story. I want to start, though, with an endorsement that I read when you were gracious enough to send me your book. And when I read this endorsement, I thought this just kind of sets the tone for me of what I think I'm about to read. And this is an endorsement from Pastor Tyler Minton in Lacey, Washington. He says, in a social media world that glorifies perfection, it's refreshing to read a raw and vulnerable story about the parts of our lives we'd rather leave hidden. Mark does a fantastic job of being both raw and hopeful, authentic, yet compassionate. This book is a must-read. I would say I agree with that 100%. This is a must-read. I think there's a lot of people out there that can benefit from this book and what we're going to share here in a little bit with your story. So, long-winded intro to ask you if you would just tell us who you are and share a little bit about your story with us.
Sure. My name is Mark McNear, and I am a licensed clinical social worker. I'm in private practice in New Jersey, and see patients. And I would say that even my caseload has changed drastically since I've gone through some transformation in my own life and have written this book. So I'm really glad to be here and to share with you. I'll start out with kind of where this started out. It was about 8 years ago, in March, it was 8 years ago that I had called a doctor who was prescribing medication for me, and had asked her to refill some of the medications. And it became clear to her right away that I was playing with the medications and that I was abusing medication. And I was taking my wife's medication that was prescribed and taking as much medication as I could to kind of numb the pain. And so I talk about this being the worst day of my life and probably the best day of my life, because it really started a period in my life of transformation and honesty, and being able to be vulnerable about things that I had struggled with my whole life and was not able to talk about. So it was about 8 years ago that I called the doctor, and the doctor right away said to me, you're abusing the medications, and you need to go into treatment. And so that was not news that I wanted to hear, but it was news that I heard. And then I talked with my wife about it. I knew that I had to talk to her, and she was just so kind and so filled with grace with it, and so loving. And, we talked about whether I should go for outpatient care or whether I should go for inpatient. And, she, again, was very gentle but very straightforward and said to me, you know what, you're not even functioning. You're not getting out of bed. And when you do get out of bed, you just sit and watch TV. And so I really think that you need more of an inpatient rehab. So I started researching places, and I found a place. It was the Care and Treatment Center in Pennsylvania. And so in the middle of that time, I called my daughter. She was living in Florida at the time, and had talked with her about it. And again, she was so filled with grace and so loving. And she said, I am so proud of you. I'm so proud of the step that you're taking. And so that was just, I feel very emotional even saying that, because it was just like God used people in my life step after step after step for healing. And that was the beginning of me being able to be brave enough to walk through the doors and to check myself in for a few months of rehab.
Now, where were you at the time as far as your employment? What were you doing at the time?
I was counseling, but not counseling very well, and had ended up really cutting my hours back to a few people a week. So I really wasn't functioning. And so I had gotten to the end of really being able to function at all. And I think that it became apparent in my marriage. it became apparent in my fathering of my daughter, and it became apparent to me, like I was in such denial that I was okay and that I could handle this, but I couldn't.
Mm-hmm. Yeah. I think the reason that I wanted to know that is because you were counseling people when you yourself needed help, and I think that's important to understand that you have a doctorate, you have a couple masters, you're well educated. That doesn't prohibit problems from entering your life. And I'll let you continue to talk about your story, but there was something below the surface there that even started with the medicating.
Absolutely.
To try to cover the problem.
So I can remember driving to rehab and talking with Debbie. Debbie drove. I was in no shape to drive. And so Debbie drove and I was pretty shut down. And toward the end of it, it was a beautiful day. And I can remember just thinking, like, my life is over. Like, my life is over. At best, God, tolerated me, but that he couldn't love me. And I can remember thinking, I disappointed my family. I disappointed God. I disappointed friends. I disappointed clients, and really felt like my life was over. And really, it's funny because when we get to the end of ourselves, it's kind of like for me, it's where God could step in and start really working in the mess. Yeah. And I think about a quote that I wrote down for today. It's by Sheila Walsh, and she states that my brokenness is a better bridge for people than my pretend wholeness ever was. And so I have really experienced that in my own life. And since I've stepped back into counseling people and working with people, that I think I'm so much more effective now in being able to acknowledge how broken I am, and that I'm in the process. Philippians 1:6 talks about, be confident of this very thing, that he who has begun a good work in you, he will continue it until the day of Christ Jesus. I'm in that process now. I haven't arrived.
Yeah.
And some days are better than others.
None of us have. So whether you're dealing with an addiction or any issues like that, we're all in that same boat. I mean, we are all being sanctified daily. And so I think that's important to understand.
Absolutely.
Yeah. So you had this support of your daughter, which was huge, and your wife certainly, which was huge too.
So important.
I can't imagine going through something like that and not having that support, because you were feeling, as you were going to this treatment center, you were feeling like you had failed everyone.
Absolutely.
Can't imagine what that was like without support.
Yeah. And so I walked through the doors, and in my idealistic way of thinking, I thought, well, it'll be like 30 days, I'll get out and I'll start life and everything will be fine, and that's not what the Lord had planned. And so I got there, and one of the things that happened right away is that as the medication was going out of my system, the memories of my child were coming back really with a vengeance. And that was so painful. And, people in the facility were encouraging me to tell my story. And I didn't have the words, and that's why I ended up writing the book afterwards, because I really, and that's so common for people that have been traumatized, they don't have the words for what has happened to them. So I can remember sitting with a group of men and with a leader, and the leader spoke up, and I talk about this in the book. The leader spoke up and asked me a question. He said, tell us about the sexual abuse with your dad. And I can remember that I just felt extreme panic and began to go into a panic attack because, number one, I wasn't ready to talk about it. And number two, even if I felt emotionally ready to talk about it, I didn't have the words for it. I literally did not have the words. I had played these things over and over and over in my head, but I to be able to express it verbally.
So I would imagine, going back to the medication, that was what was kind of soothing or kind of numbing that pain.
Absolutely.
Is that your past trauma?
Yeah, I had gone to Bible college, and I had gone to Bible college for 5 years. I went originally to be a pastor, and then transferred into a program to be a counselor, and then started at NYU and started my first master's at NYU in social work. And in between that time, I had felt so much anxiety and just so much panic that I went to a psychiatrist, and there were medications prescribed to me, and I began to abuse them, and like immediately, because they gave me a sense of numbness that I perceived as being a calm, and it just shut down all of the emotions that I had from the trauma that I experienced.
Wow. So I'm thinking about those that are out there who have, maybe it's not child sexual abuse, but any kind of trauma in their past, who maybe not numbing it with medication, maybe it's alcohol, maybe it's something else. Would you say that it's correct in me thinking that those are things that they're doing right now to numb that? And if so,
absolutely,
we'll talk about what your story, how your story progressed. But do they need to go to a center, a rehab, or anything like that? I mean, obviously, it's a blanket. You can't give a blanket statement.
That's a great question. I think that the one thing that I would say is the first thing that would be helpful for them is to find somebody safe to talk to about what they're struggling with. You know, whether it's alcohol or whether it's watching porn or whether it is drugs, whether it's gambling, whatever the behaviors are, you know, to be able to find someone safe to talk to. And that's what I was so privileged to have Josh McDowell be a part of this project. And that's one of the things that he had talked about when I first got out of rehab. You know, in rehab, they told me to tell my story, and I was like, no way, and I can't anyway because I don't have the words. And then I had a lot of free time where I was watching YouTube video after YouTube video after rehab, and I watched Josh McDowell's testimony probably 6 or 7 times. And, you know, he kept saying, I guess I was looking for a different thing for him to say. Each time I watched it, he would say, you know, you need to find somebody safe. You need to talk about your story. Yeah. And so, again, I resisted it and said, no way am I going to do that. And again, in being fair to myself, I didn't have the words for it. Sure. So God took me step by step by step. It's you know, really the power is in your story, learning your story and learning what you're trying to avoid. And that's the thing that I wanted to avoid. You know, I began working with a counselor when I got out of rehab. And we started just initially talking about some of the traumas that happened. You know, I talked about the fact that my dad had forced me to eat carrots at the age of 4. And then I ended up vomiting on the table, the dinner table. And he became irate and picked me up and threw me in the garbage and said, stay there, you're a piece of garbage. Mm-hmm. Stories like that, the story that I talk about in the book of being sexually abused from the age of 4 to the age of 7. And then that stopped. And I felt a tremendous amount of abandonment because even though that was very painful, there was also a connection there with my dad. You know, and it happened, I talk about in the book that there was armed robbery where 4 men came into our house and robbed our family. Which caused a lot of dysfunction in the aftermath of that happening to the family. And my dad became very paranoid. My mom became an alcoholic. I can remember going to bed and having nightmares and night terrors and just crying. You know, so definitely what I have learned in my own story is that addictions, and I've had a lot of things that I've struggled with, addictions, the underbelly for me is trauma and dysregulation emotionally, and me trying to emotionally regulate myself through substances and processes and other things.
I think when we talk about substance abuse, whether it's alcohol or drugs or something like that, does that always pinpoint to some past trauma?
It seems to. The literature definitely seems to point to that. I think that a lot of times people look at what they went through in their family or in their life, as something that's relatively normal because it's something that they experienced, and they normalize it because that's what they're used to. But I think that as they begin to explore it, they find that, most addictions, if not all addictions, are an attempt to self-regulate your emotions.
Wow.
And certainly I can say, in hands down in my story, that's what happened.
Yeah, clearly, as the story unfolds in your book, it definitely points back to that. You also mention quite a bit in your book about community, and that we were made to be in community, and that you mentioned just now that when the abuse stopped, you felt a sense of abandonment.
Absolutely.
And so you go from trauma to abandonment. So that's trauma in itself.
Exactly.
I would imagine.
Yeah, exactly. It is. And so it took me a long time to warm up to the idea of being in community and being able to share this. And again, it's amazing to me how God step by step led me in different treatments and in different communities. And I talk about in the book getting involved with Pure Desire Ministries. What I have my counselor, and I just love Harry so much, and we're still working together today. But one of the things that he had me do, which became chapters 4, 5, and 6 of the book, which I didn't know that was going to be, is he had me write down a list of traumas that I experienced. And so I wrote them down, and we worked through them, we talked through them, I journaled, I drew, all different types of things. And Harry, and I talk about this in the book, how much he valued me and valued my story. And that was healing in and of itself. And then he suggested after some time of working together that I get in a group with other men to be able to talk to them, and share with them and hear their stories, and for them to hear mine. And each of us have very different stories, but we can relate to each other.
Yeah.
I think the other thing that I talk about in the book is, Mike, that idea that isolation, helps addiction to feed, and to grow. It just feeds it and it grows.
You know that I work at Covenant Eyes, where we talk about finding healing from pornography, and that's so true in that specific issue of being addicted to pornography, is that isolation is where it thrives.
Yeah.
And so being able to talk about things like that in community. I told you before we started recording that, you at some point had to have the courage to step out and say, this is my story. I find that very admirable, because it can't be easy to say, this is my life. This is what I felt about myself. Regardless of what God said or who God said I was, I didn't feel that because of the shame. And this kind of goes back to what the quote from Pastor Tyler Minton said, in a social media world that glorifies perfection, nobody wants to talk about the raw and the vulnerable. And I think that's a part of what you're saying in the community part there.
Absolutely. And if you would have told me 7+ years ago that I would be talking to you about my story, I would have told you that you were absolutely crazy. I mean, I was just convinced that I would take a lot of the things that I shared to the grave, that I was not going to share them with anyone. But that's the healing power of community, a safe community. Yeah. I should preface it by saying a safe community. And
you mentioned finding a safe person, and that's where it starts, correct?
Absolutely. Yeah, and I had gone through rehab for 3 months, and then I went into IOP, intensive outpatient counseling for I think it was a year, 3 times a week. Wow. And at the same time, I was going through individual counseling once a week. And then it wasn't until really I shared a little bit here and there, but then it was getting involved with Pure Desire and getting involved with Harry Flanagan that I really began to share and talk about a lot of the things that I talk about in the book, and then I talk about, I think it was in the foreword that I talk about, there was a couple that we had Bible study with, and they encouraged me to write down, my memories and then to put it in a book. And so that's what really catapulted me. But that was years after being in rehab. I had to process this stuff and get to know it. And there's still, the thing is, there's such hope. I like I said, I see God working, step by step by step. And yet there's so much pain. There's not a day that goes by that I'm not haunted at times by the memories of the abuse. But that's okay because there's that hope there. Jeremiah 31:3, I love the verse it talks about, that he loves me with an everlasting love. Another verse that has become really, really important to me regarding my story and the shame of my story is in Ephesians chapter 2 and verse 10 that we are his handiwork, or we are his masterpiece. We are created long ago to do good works that he planned for us to do. Yeah. I think the Greek word, I don't know if I'm going to pronounce this right, but it's poemi, which we get the word poem. That God is writing our story. He is the poet, and we are the poem. And he's not ashamed.
I saw a T-shirt.
Poet,
That's exactly right. I saw a T-shirt recently that just stuck out to me. It was very simple and kind of crude. It just said, "God doesn't make junk."
Absolutely.
And I kind of smiled, but I thought, that is so true.
Yeah.
What we struggle with and what you struggled with in your story was we live in a sinful world. And if we don't recognize our relationship with the Lord first, things quickly get out of alignment.
Yeah, absolutely.
And I believe that's what happened in your story was not so much even you, but people around you were completely out of alignment with what God's plan for their lives was. And you were the kind of the subject of that in a negative way.
Right. Yeah, and it's amazing the hope that is there, no matter how broken you feel that you are, that there's healing there, and there's growth, and there's opportunity to serve and to help others. And just to go back, Mike, for a minute, that idea of the one another's is such an important concept. And the practical application of it, just bear one another's burdens or confess your sins to one another that you may be healed. Verses like that are so important in this recovery that I have gone through.
Yeah. So again, I think about the person that's struggling right now with something. And so I think what their takeaway is, I need to find someone safe.
Yeah.
That's a big first step.
Yeah, and
I've got stuff in my life that I don't even want to confess, let alone tell somebody else about. You were there. That's kind of where we ended with your in your treatment, is that you were being encouraged to share your story. So I'd like you to pick that up, but also recognize that for those listening, going, you don't know my story. I don't like to even think of my story. Maybe I'm medicating that. Maybe I'm soothing that, and you're telling me I need to find someone to share that with.
Mm-hmm. Yeah. And I think that, again, if you would have said that to me at the beginning of this journey,
exactly,
I would have said, no way. But I think that in looking at the healing that takes place in other individuals' lives, sitting in a safe group, even if it's AA or NA or SA, whatever, just sitting and hearing stories. You don't have to say anything. Just sit and just hear their stories first. I think that just finding that one individual that'll be safe, that is not going to talk about your story or gossip about your story or use it in an inappropriate way. Sometimes it takes someone that's already been there to be able to talk to, that can bring mercy and grace and love. I love the verse in Romans chapter 2 and verse 4. It is the kindness of God that leads to repentance, or it's the kindness of God that leads to change. So many times, and I talk about this in the book, so many times we want to take a sledgehammer to our story and beat the story up and beat ourselves up, but that's not the way to change. It's through kindness that allows for change to take place.
Yeah, if I have a problem, I want to find somebody that has walked that road.
Absolutely.
Because they know it they know it very personally. And I don't necessarily want to hear advice from someone who's not been there. Mm-hmm. And I think that's why, again, I'm so encouraged by your story, because you've been there and you had the courage to step out of that and continue to move forward as you are today.
And I think that, and I would be quick to say that courage came through other people helping me.
That's right. Yeah. Yeah, you had to find that through someone else in
Absolutely.
order to get you there.
Yeah.
Yeah. Very good point. So, Mark, where are we at in your story now? You said you had actually spent quite a bit of time then through counseling.
Yeah, I immersed myself in counseling. I was working with Harry Flanagan for about 2 years, trying to process my story. And now I see him on a regular basis and am involved in counseling with him. I also am not hesitant to get involved with other types of counseling that I need, to be able to. It's an ongoing process for me. I talk about it in the book that trauma recovery is not a procedure; it's a process, and it's something that goes step by step by step. There's things that I struggle with daily, and that's okay for me to struggle with issues of depression or issues of anxiety. Flashbacks are a big thing that I deal with on a regular basis, and finding ways to cope with that, finding ways to be able to function in the middle of that. It's really important for me, which I've been able to do, and I'm really, really grateful for that.
Yeah, healthy ways, because you were finding other ways to medicate that.
Absolutely. But I'm glad you said that.
But I also want to say too, you've gone through a tremendous amount of healing to the point where you can share this with others. You can relate to others who are going through that, but you can't forget about that. That's always there. The trauma is still there. And I think that's because we are living in finite bodies. Our minds, physiologically, can't forget. God says He can forgive and forget. We cannot forget.
Exactly. And
I think you also talk about how your body remembers things
absolutely
that you don't even touch on that.
Absolutely, Mike. I tell a story in the book of my dad force feeding me carrots and ending up vomiting and ending up in the garbage. And then I think I was 28, and my wife Debbie, and I went to a wedding. And when we were eating at the wedding, it was steak and potatoes, and looked really good. And there were also carrots there, and they looked really well. They were prepared well. And so I was not even thinking about it. And I took a bite and began to gag immediately. Mm. So I think that idea, Bessel van der Kolk talks about the body keeps the score. I think that is so true, that the memories are there. And until we're able to resolve them, and some of them will be resolved here, and some of them will not be resolved until we're in heaven.
That's right. That's right. I also want to touch on you were this. I don't know why this just stuck out to me. You were referred to a quote from Dr. Kurt Thompson, who I have a lot of respect for, and I'll quote this little short paragraph here. It says, "Everybody in a family sees the family differently. Each person has a different story to tell." Dr. Kurt Thompson described this idea perfectly when he wrote, and I quote, "No sibling grows up in the same household." You talked about, in this particular part of the book, you talked about your brother, and kind of how he grew up and how you can't tell his story and you can't tell your sister's story. But explain a little bit about that, because I thought that was a really interesting concept too.
Yeah, I think the idea that no sibling grows up in the same household, the oldest child is the oldest child. The middle child is, in reference to my family, the middle child, my sister, was the middle child, and I was the youngest. And so all three of us had different experiences coming into the world. My brother came into a family without any other siblings. My sister came into a family that had a brother, and I came into a family that had a brother and sister. So each one of us came into a different family, and we were treated differently by our mom and our dad. And also we had different personalities and different perceptions. So, I wanted to make the point in the book that I was not going to talk about my brother's story, and I wasn't going to talk about my sister's story. That's their story. I wanted to focus in on mine and what I experienced growing up.
Yeah.
It's kind of like You know, it's kind of like seeing a car accident. You know, eyewitnesses seeing a car accident. You know, you get 4 people that see a car accident and they all describe it differently because they're standing in different places. And that's the same with siblings. They describe it differently because their perception of it is different from where they were standing.
Yeah, you need to read the book to understand how that all fits in. But I think it struck me because in my family, there are 4 of us kids, and we all have different personalities. We all have different lives. Yeah. And we've talked about that with my own 2 children and how they grew up under the same covering of, you know, Christ first and all the things that we taught them, but they are 2 very different individuals. And I think that the importance for me when I read that was to understand that we don't all perceive the same way, and we don't all retain things. I guess that's not the right word, but when something happens, I may take that very personally where someone else doesn't. And I think that's something important to
and even looking at temperament. You know, my brother has a different temperament. My sister has a different temperament than me. You know, so they're going to perceive it differently, and they're going to take it in and assimilate it and understand it differently than I do. Yeah.
So clearly, you've made lots of progress. Can you touch on how you went from the counseling, the treatment center, to where you are now, and what you're doing now? Clearly, you have the book, which I really do. I don't always say this is a must read. I think this is such an important book for people to get their hands on and to read, and we'll talk about that at the end. But how did you get from there to where you are now?
There was a lot of work that the Lord had to do in my life and continues to do in my life daily. I think that, as I mentioned, a lot of counseling, a lot of input from others. I think that, you know, my life was pretty bad. It was pretty sad, you know, and it has been transformed. You know, I talk about, toward the end of the book, talking about, you know, if you asked me to talk about my life, I would have asked for a little piece of paper, and I would have asked for, you know, maybe a black crayon or a white crayon. Now I need the full pack of crayons because my life really has been transformed. My marriage is wonderful. And I don't just say that. I mean, it really is wonderful. And I attribute that to my wife, who is a very understanding, very loving, and very grace-filled individual. My relationship with my daughter has been transformed. And I am so grateful for that. She has gotten married, and I talk about that in the book. And Emily lives right now in Wyoming with her husband, Brandon, and I have a great relationship with both of them. So God has really blessed me in ways that I never expected. I do counseling. You know, I'm in practice, mostly individual, some couples work. But I as I said to you at the beginning of the program, my work has shifted, and I'm working with a lot of people now with trauma and addictions. And so that is really my passion.
Think about your daughter, your relationship with your daughter without this help. And I make that point because I really want to drive home the fact that you keep talking about hope, and yet you were in such a situation that seemed so dark and hopeless. And I want to keep driving that home because I know there are people out there listening who maybe don't even think much consciously about the trauma in their past. Maybe they don't think that what they experienced was trauma, but it's affecting them.
Yeah, Mike,
I want to make sure that they know there's hope.
I had accepted Christ when I had, at the age of 19, when I had gotten in a very bad car accident. And again, I talk about that in the book. And, you know, things went sideways with my life with the addictions that I had. But, you know, I think that I had lost hope. So I know what that's like. And I think that I just didn't see a way out. And yet, looking at it now, there was a lot of work that needed to be done, but it was in some ways so simple just to reach out for help. You know, and to continue to reach out for help. And my wife is one. Debbie is always saying, you know, that God took you from this step to this step to this step to this step, and you know, he doesn't let us know what's coming next. But in the season that I'm in right now, and in counseling that I'm in, individual counseling that I'm in, and working on things that I'm working on, are things that I wouldn't have been ready to work on maybe 2 years ago, but I'm ready to work on it now. And so, there's tremendous amount of hope, that I would have never been able to talk about this stuff and talk about and write about it in the book. But it was the hope that had driven me to it, because, like I said to you, I had agreed that I would never talk about any of this. And I wrestled with God constantly, because he kept saying, I want you to talk about it. And I was like, there's no way that I'm going to. But, he won. And I'm glad he won, because the freedom is in being able to talk about your story, talk about shameful things. And I don't think there's any better remedy. I know there's no better remedy for shame than Jesus Christ. And the worth that he gives us, and what he did on the cross for us as image bearers, and the fact that he loves me. I want to go back to that, just that idea, the hope that even when I don't feel it, and there's days when I don't feel it, but that he loves me with an everlasting love, Jeremiah 31:3.
Yeah. Yeah, I think about Psalm 139, which I just talked about in a couple of episodes ago, is one of my favorite chapters in the Bible. That he knows our story before he's got our story written down before even one of them come to be. And I think that we have to keep that in mind, that God already knows our story from the very get-go. Even as a little baby, he knows our story. We don't have to be ashamed to share it with him, because he already knows it, and he still loves us. And I think that the more that we understand the depth of his love and the redemption that he has for us, the more we love him in return.
Absolutely. And he is so much bigger, and this is such an understatement, but he is so much bigger than our stories. And as you said, he's not ashamed of our stories. He dives right into the messiness. When I was in rehab, he showed up, and I thought that, I needed to clean up my act before he would approach, and that's not how he works. He dove into the messiness of my story with no problem with the messiness of it. He took the shame away.
Yeah. He lived as one of us for a reason. He needed to experience what we walked through day by day, and he did, but he did it without sin. And that makes me love him even more, to understand that he knows me intimately, because he was walking on this same earth that we walk on today, amidst all of the
I think
the
about
messiness.
Hebrews, where it talks about we have a high priest who understands.
Yeah, that's right.
Yeah, none of this is foreign to him.
That's right. Mark, is there anything else you want to share as we close? I want to talk really briefly about your book, but any advice that you want to share with us, either from your book or from your life?
No, I would just reiterate the importance of finding somebody safe to talk to. I would encourage people to get in counseling. There's nothing to be ashamed about in getting into counseling. Scripture talks about and encourages people to find good, godly counsel.
That's right.
I would say that community is really important. Friendships are really important. For me, friendships are a really, really important thing. Yeah. I think that don't be afraid to step out, because that's where the help is. And I know for me, I am so grateful to be able to, walk day in and day out and be somebody who can provide hope for others, because I know what it's like not to have hope. And that was one of the reasons that, I fought with God a lot about writing the book too, because I wasn't too keen about putting all of this out there, or putting a lot of my story out there. But I'm glad I did, because I think it provides hope for other people, because I have been pretty traumatized, to say the least. And, if God could work in me the way that he has, he can work in others. And you do find the hope, you find the gratitude, even in the messiness of your story.
We said that first step is a doozy. It's a big one. It takes a lot of courage, but that's also, as we hear from your story, that was also when change began.
Yeah,
so
absolutely.
there is hope in that first step. Dr. Mark McNear, your book, Finding My Words, A Ruthless Commitment to Healing Gently After Trauma. Where can people pick up the book at?
They can get it on Amazon. It's okay. On Amazon from Renown Publishing.
Awesome. We're going to put some links in the show notes so that people can follow up with us and learn more about where to get your book, some of the links that you provide as well. Dr. Mark McNear, I want to thank you so much again for being on the show. Would love to have you back as you continue to walk this journey. We talk a lot about hope here. That's the name of the show. And anything that provides hope to others, we want to hear about. So you're welcome back anytime. Thank you so much for being with us today.
Thank you, Mike. It's been a pleasure.